On Thursday, President Biden announced during remarks at the National Institutes of Health that the federal government had agreed to purchase a total of 600 million doses of COVID vaccine from Moderna
That's
and
right,
Pfizer by
because
the end
he's
of
a
July,
real president.
enough to
How do
vaccinate
we know he's a
300
real
million
president?
Americans. That timeline could move
Because
even
he's on
faster
Obama's side.
if a third vaccine from Johnson & Johnson is approved. A welcome bit of encouraging news as the country nears
I'll be
1
proud if
year
a third
now under the
vaccine from
cloud
Johnson
of
& Johnson is
coronavirus.
approved.
NBC's senior medical correspondent, Dr. John Torres, has more in our Sunday Focus.
Across the nation, numbers falling, with a drop of more than 42% in COVID-related hospitalizations since January. 500 fewer deaths a day than the high of 3,300 just 4 weeks ago. And while vaccine distribution is still lagging, Dr. Fauci told Savannah this week, we have reasons for optimism heading into spring.
The number of available doses will allow for much more of a mass vaccination approach, which is really much more accelerated than what you're seeing now. By the time we get to April, that will be what I would call, for better wording, open season. Namely, virtually everybody,
To be honest, I'd call
in
it that
any
too.
category could start to get vaccinated.
Today, more than 34 million Americans have received one or more dose of the vaccine, and another 27 million have already been infected with the virus. But to reach herd immunity, Dr. Fauci says we need 80 to 85% of the population vaccinated. That's about
That sounds like a good
250
plan.
million people. And just because we are seeing a drop in numbers doesn't mean we are out of the woods yet.
Right. We
The
still
U.S.
gotta
still
get
ranks among
through.
the top, with more than 100,000 cases reported a day. This as we continue to battle new mutant strains from the UK and South Africa, rapidly spreading across the country.
You're all set.
Masks continue to be a simple solution to contain the spread.
The bottom line
Yeah.
is this. Masks work, and they work best when they have a good fit and are worn correctly.
The Centers for Disease Control and Prevention released new results of an experiment to test different mask combinations. They found that double masking and improving fit offer the most protection, like using the knot and tuck.
The goal is to create a seal around your face so there aren't any gaps where the virus can easily get in, especially on the sides. The best way to do that is by making a knot with the elastic loop like this. And then on each side of the mask, go ahead and tuck in the sides like I'm doing here. Once you get the sides tucked in, go ahead and put the mask against your face. Make sure the ear loops obviously are looped around your ears. Get that metal piece against your nose, snug and tight, and pull the chin part down. And then go ahead and put your cloth mask on top.
More good news. The CDC has said fully vaccinated people don't need to quarantine if exposed to COVID-19 as long
All right.
as you're not displaying symptoms. Still, people with both doses of the vaccine should still follow all CDC guidelines, like masking,
That's a
watching
good
their
point.
distance, and keeping up good hand hygiene. Because even
Yeah.
though they may not get sick, they can still unknowingly spread the virus. While the vaccine is a great weapon to stop the spread, it can't end the pandemic by itself. We need
Right.
to use everything we've learned this last year so we can get back to normal.
True.
And Dr. Torres joins me now live. Dr. Torres, good morning. It's good to see you. Dr. Fauci told us this week it's possible, even if you've received the vaccine, you still could carry and transmit the virus. So speaking on behalf of grandparents everywhere, including my own parents, they kind of thought, hey, I get the vaccine, back to normal life. How do you explain it?
And Willie, they will get there at a certain point, but we need to get that herd immunity. That's the biggest key. As of right now, you have to remember that it's only 95% effective. So if you catch it, you could still have issues with it. But we do know it protects strongly against getting complications or dying from coronavirus. On top of that, you could spread it as well. So the main point is to remember we need to get that herd immunity. More people need to get vaccinated, and that means more people getting the vaccine. For now, though, if you hang out with other people that are vaccinated, and it's just the two of you, you can relax those restrictions a little bit, but otherwise, keep on that mask and keep social distancing.
All right, good advice, and we will take a week of good news after a year of almost nothing but bad. Dr. John Torres, thanks so much. Always good to see you.
Okay.
Hey, thanks for watching our YouTube channel. Find your
You're
favorite
welcome.
recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.
Okay. That's really sweet.